So when I was growing up, I was always exploring. From just about the time I could walk, whenever I'd go over to my grandparents' house, I would sneak out and climb this radio antenna. Some of you may know what that is. Radio antenna up the side of the house and get onto the roof, even though I knew I would get into trouble. And let's just say the fire department may have been called on one occasion. Other times, I would take apart my toys, new or old, just to see how they'd work, or to reconstruct them as something else. While I'm sure my parents thought of it as me being mischievous, I now think of it as creative disruption. I enjoy how even a small shift in perspective can open up new possibilities. Now, as an architect and strategic thinker, my career is largely devoted to doing just that, by creating buildings and places that help improve the well-being of others. A career focused on design, which challenges me to see things from multiple perspectives on the issues that we face. So today, at a time when we're increasingly socially divisive and tempted to isolate ourselves, I want to talk with you about the impacts on your health, the importance of community, and the role of design in addressing these challenges. I want to shift your perspective. In the United States today, we spend more annually on healthcare than any other country in the world, and yet we rank last by almost any measure. We're 39th in infant mortality, 36th in life expectancy, just to name two. When you look at the headlines, much of our time and attention is focused on healthcare and its rising cost. Now, clearly, this is an issue that can and must be addressed. But what if I told you we might be looking at the problem from the wrong perspective? What if I told you that just 20% of our health and well-being is attributed to your quality and access of health care? Research shows that 80% of your health and well-being is directly attributed to social, economic, environmental, and behavioral factors. Factors which trigger sharp rises in chronic diseases like obesity and diabetes. Factors which relate both directly and indirectly to how and where we live. Your life expectancy is dependent on your zip code. A 2013 Robert Wood Johnson Foundation study found that as few as 2 train stops in the same city can mean a 7-year difference in life expectancy, 13 years in some locations. Now, before you pack your bags, you should know this is true of Detroit, Dallas, DC, El Paso, pretty much most places. Why? Because where we live impacts how we live. I want to share a story that illustrates this. In the 1960s, there's a small rural town in eastern Pennsylvania called Roseto. Roseto was an Italian immigrant community named after a town in Italy that featured closely spaced houses and walkable streets. They had 0 crime rate, 0 suicides, and a heart disease rate that was nearly half that of the national average, as well as neighboring towns. They didn't have a single death under the age of 45 due to heart disease. Men were living so much longer that there were more widowers than widows. What was truly remarkable is that they worked in stone mines, ate fried foods, drank wine in abundance, and smoked habitually. They did pretty much all the things that health professionals warn against, and yet they lived longer. Why? Researchers studied the town, pored over death records, and what they found is that they lived longer because they were less stressed. They were less stressed because they looked out for one another in a close-knit community. If one family was sick, others pitched in. Families would cook meals together. Town elders would help take care of the kids. Imagine a town where weddings would spread out from the church into the neighborhood streets. There wasn't a social hierarchy. There wasn't this keeping up with the Joneses mentality. In short, they shed stress in a very healthy way, interdependently, together, and drank as much as they wanted. However, researchers also made a prediction that within a generation, as suburbs expanded, houses grew, fences popped up, that social economic isolationism would set in and change this. The community would divide, stress would rise, and health would decline. So they went back in the 1990s, 30 years later, studied the town again, and found this to be true. Today, Roseto has the same heart disease rate as anywhere in the United States. Where we live impacts how we live. Unfortunately, today, our lifestyle is totally geared around cars. We drive more and walk less. Children walk or ride a bike to school 50% less than they did just 30 years ago. That's a drop from 60% to just 10%. Many of us live in food deserts where fresh produce is non-existent and fast food is most convenient. Over the last 60 years, we have slowly and methodically replaced walkable neighborhoods, walkable communities with car-oriented suburbs that not only limit healthy behavior, but may even discourage it. Our stress has never been higher. Now, there is good news. The good news is that our physical environment, where we live, work, play, and heal, does account for much of our health that we can control. So the solution doesn't rest alone in improving the delivery of health care. It rests in delivering healthier communities. Imagine if we could take even a small amount of the effort underway with healthcare reform and reinvest that into how and where we live. And what if we could do that through design? Think about it. In my profession as an architect, today we design green buildings to be resource and energy efficient, to do less harm, to in effect be less bad. But what if tomorrow we design buildings and places that actually promote and encourage health and well-being? This is where the opportunity lies, so that where we live impacts how we live in a positive way. Not only is this happening, but it is happening in a place with limited resources, little skilled labor, and virtually no infrastructure. Kechembala, Uganda, is a village in Eastern Africa, rich in tradition and culture. This is evident through their celebrations where men, women, and children dress in vibrant clothing and celebrate together. However, it's also one of the country's most impoverished. $2 a day is the average annual income. Life expectancy is 15 years below global average at 56 years. Infant mortality is double the global average, with 1 in 26 newborns dying before their first birthday. Now, some of this is due to a need for better medical facilities, but much of it is due to community infrastructure and resources. Women would be turned away from the birthing center due to capacity issues, some after traveling long distances on the back of a motorbike while already in labor. Many wouldn't make the trip. Often the result is women giving birth at home without assistance or sterile equipment. Clearly, new facilities were needed, but in a way that would work for and be embraced by the community. This is not something that could be dropped in from afar by outsiders that assume they know what's best. To be successful, the design had to be in collaboration with the community. The real solution had to come from within. Ultimately, the way it was built and who built it had to be adapted. With a lack of reliable infrastructure such as power and water and a scarcity of materials, sustainability wasn't an option, it was absolute. To help with unemployment and to improve skilled trades, 40 community workers were trained in regional construction techniques such as making mud bricks by hand, techniques they can now carry to other jobs and other services. However, training wasn't just limited to construction workers. As one example, I want you to meet Julianne. Julianne was trained by a midwife during the construction of the project in how to deliver premature babies. In just a few short months, Julianne has helped deliver several premature babies that otherwise would not have survived. Now, Julianne and her village illustrate how a single project can positively impact the trajectory of a community, starting with expecting mothers, but extending to other families and now skilled workers who can afford an education for their kids. They didn't just build a building, they used design to help shape the health of their community. Now, for an example closer to home, there's the Urban Food Studio. In Washington, D.C., the Capital Area Food Bank provides leadership, training, education, and food to over 400 partner agencies, such as churches, schools, synagogues, things like that. 16% of the D.C. population struggles with access to food. Access to food is actually a root determinant for many of a hospital's super users. The Capillary Food Bank realized that improving access to food had to be about more than just giving out meals. So they launched a demonstration garden for nutrition education and gardening basics. Due to its success, they then engaged volunteers to expand and enhance the capabilities of this garden. The result is a multi-purpose garden, an urban food studio that provides all-season access to cooking workshops, classes, and other educational events. Reflecting their values to be environmentally friendly, the structure itself demonstrates sustainable ecosystems such as rainwater collection and solar harvesting. The studio teaches individuals and families that whether you have a backyard or a balcony, you can learn how to grow food and how to stretch your food budgets farther. The result is a place that empowers healthy choices while improving access to food. In both cases, Ketchimbala and DC, these started through the efforts of a single individual. With Ketchimbala, it was somebody in the area that sat with village elders to understand what was their most pressing need. With the food bank, it was an individual passionate about sustainable design. She found out they needed expanded facilities and then leveraged her network to bring it to life. In both cases, they didn't just donate their time, they used design thinking to help make it happen. So when we talk about design thinking, what are we talking about? We're talking about an iterative method for practical, creative problem solving. The type of thinking that brings together social, cultural, environmental variables into solutions that can help communities thrive. But the real impact to design thinking is in the ripple effect. Like a pebble in a pond, design thinking isn't just about the initial concern, but is about the ripples. That is, the impact you can have beyond the initial idea being considered. With Ketchimbala, the ripple effect of building new birthing suites was enhancing skilled labor and improving sustainability. With the food bank, the ripple effect was about improving access to food. Where we live impacts how we live. Rural, urban, or anywhere in between, we can and must come together as a community to improve our health. My passion, if you haven't guessed by now, is design. In my practice with HKS, we do this by thinking beyond the property lines of our clients on how buildings impact neighborhoods, how neighborhoods shape place, and how place influences behavior. Personally, I first committed to doing this about 10 years ago through the creation of a design fellowship within our firm that paired designers with architectural students to work on a community need. Out of a single event, it has grown to cover over 5 cities and 20 needs that have ranged from affordable housing in DC to improving connectivity and walkability in Dallas. For me, it's about shifting our perspective on what truly impacts our health. For using design in the built environment to influence healthy behavior. Fundamentally, for shaping places that encourage kids and parents to walk or ride their bikes. Where we live impacts how we live, but how we live is a choice. So what if we all were to use design thinking to impact the health of our communities? What impacts would we have? What communities would we create? The best part is you don't need to be an architect, a designer, or a health professional to be a catalyst for change. Design as a way of thinking and problem solving is in each of us. A single person with a passion to care can have a ripple effect of their own with a profound impact. Each of us shape our communities by how we choose to engage with them or how we choose not to. So to do this sort of design thinking yourself, you simply need to observe, engage, and collaborate. Open your eyes to the challenges around your neighborhoods, schools, and towns. Engage with groups working on those issues in a way that aligns with your own passion, your own ideals. Collaborate with those groups so that change happens within. Change also starts with a commitment to care. This was apparent to me personally at the 2013 Boston Marathon. As a runner, I was stopped about a quarter mile from the finish when the bombings happened. Before long, there were several hundred, maybe 1,000 runners held in place, tired, dehydrated, cold, wet, held in place while medical care was rightfully focused on those injured at the finish. Held in place while many of the runners were starting to have medical issues of their own, common to running that far for that long, but magnified by the cold temperatures and wet clothing. I didn't see the heroics of those at the finish, but what I did see was strangers, spectators, who came together, sharing their own clothing, their own water, their own blankets, in some cases opening their own homes to strangers. Individuals, hundreds of individuals who came together despite the fear, despite the chaos, regardless of anyone's politics, came together as a community. The day was tragic, but like many, I was inspired by our shared humanity. We must shift our perspective. The solution doesn't rest alone on Capitol Hill, where the focus is on the 20%. Nor is it isolated away in our own political echo chambers. The solution's in here. It's in our shared humanity. Together, through design thinking, we can impact the health of our communities and the 80% of our health that we can control. This is where we can do more than just be less bad, where we can thrive, where we can recover what Rosetto lost and what Ketchambala gained. Thank you.